Approval of the minutes. Do we have a motion? Motion by Mr. Dave Forsyth and seconded by Mr. Smithers out of Governor. And discussion? No discussion? All in favor?
Aye.
Opposed? No one's opposed? Carried. Okay, first thing we have is a COVID update. Dr. Dana McGuire will not be with us here tonight, but Dr. Andrew Williams is. And doctor, go ahead and enlighten us with what you know this month. Thank you.
Sure. So I'm going to share my screen. I think Dylan needs to enable that option.
It's fine.
Okay. Good evening. So I wanted to go ahead and start out. I'm going to share some information specifically about the county, but I wanted to start with the what's happening across the country. So right now we're at more than 300,000 cases per day as a nation, and you can see the ongoing sharp increase. For deaths per day, we're now fairly consistently over 3,000 deaths per day. So we have more than 16 million cases, which is a 30% increase over the past 14 days. More than 300,000 deaths, which is a 67% increase in the past 14 days. More than 100,000 hospitalized, which represents a 19% increase. And as I mentioned, more than 3,000 cases occurring on a daily basis. If you look at how we're doing in the 7-county region, right now we're averaging about 30 cases per 100,000 individuals. And if you look at testing percent positive, it's somewhere between 4 and 5% in the region. Now looking at St. Lawrence County, you're going to see the previous week's data. If you look at what's happened in just 1 week, we've had 250 new cases, which is about 35 cases per day. We currently have 17 people hospitalized, and we've had 7 additional deaths. As far as testing, and now this is data for St. Lawrence County, our percent positive is about 3.5%, and it's been staying there for several weeks now. I did want to give a quick update about testing. That was a topic that we talked about at the previous meetings. So when you look across St. Lawrence County between the St. Lawrence Health System, Claxton Hepburn, and the Community Health Center, as well as the urgent care, we have the ability to do well more than 500 tests per day. St. Lawrence Health System now has 6 of the Rionics that are up and running. And just those devices can do more than 400 same-day PCRs per day. As far as availability, there are same-day or next-day appointments available pretty much throughout the county. And there are 2 sites that are open on the weekends. Turnout time, which has been a hot topic. As I said, we have the capacity to do nearly 500 same-day PCRs throughout the county. There is some point of care testing, which is rapid, that's available. And most of the reference labs are still 2 to 3 days. As we talked about at the previous meetings, the Rionics same-day PCR is a real game changer. As far as cost, this is a big issue that's come up, and I know different legislators have asked me. Really, at the end of the day, there should be no charge to patients for this testing. So if people have insurance, the insurance will be billed. But if there's a balance, so an amount that the insurance company doesn't cover, that balance is not forwarded to the patient. So if you're insured, there should be no charge. And if you're uninsured, there's a free option. And there's no copay testing, and there's no copays at the testing centers. So we were discussing the option of a mass testing site. And what I would suggest, and talking to folks at both St. Lawrence Health System and Claxton Hepburn, is I don't really feel like there's a role for a mass testing site. we're actually, we have the capacity, we have the availability, we have the excellent turnaround times, and the cost should not be an obstacle. So although I think it may have seemed like a good idea, and it is maybe appropriate in other counties, I really don't think our community needs a mass testing site at this point. I did want to give an update on vaccines because I think that's a hot topic. So the Pfizer one, which is the RNA with 2 shots, that's 95% effective, that needs to be stored at -70. That is the vaccine that, if you look on the news, that has been made available. So this is it's Pfizer. It's actually BioNTech is the company that's helped with it. They did complete the 3 phases of clinical trials. So at a previous night, I talked about the 3 phases that all medications and vaccines are supposed to go through. So they did complete all 3 phases. They had approximately 43,000 participants in their phase 3 trial. So a very large group of people. They showed 95% efficacy. So it appeared to be very effective. And there was no major safety issues identified during their phase 3 trial. As you may know, the vaccine was already approved and has been implemented in Great Britain. So that was last week. And at the end of our past week, the FDA did grant an emergency use authorization. And then the CDC Advisory Committee on Immunizations Practices did give their final approval on Saturday. So 2.9 million vaccines apparently were shipped by either FedEx or UPS on Sunday. And if you look at that phased distribution plan, there's phase 1A, phase 1B, and phase 1C. The phase 1A is what's going to be starting this week. And so this is for healthcare personnel and for long-term care facility residents. And what New York State Department of Health is doing is they're coordinating with hospitals in order to provide the vaccination for the healthcare providers. And the New York State Department of Health is working with pharmacies to provide vaccination for the long-term care facility residents. And I should make it clear that the amount of vaccine that's being sent is fairly limited. So there's the category of healthcare personnel, but this doesn't mean that all healthcare personnel are going to receive the vaccine. Each hospital is sort of identifying people who are considered to be at higher risk and then making sure that they get vaccinated in this first round of Pfizer vaccine. When we get to phase 1B, which is the next phase, it's probably going to be a collaborative effort between hospitals, pharmacies, and with some coordination from St. Lawrence County Department of Health to make sure that those people get immunized. And then when you look at phase 1C, which is a much greater group of people, that will again be a collaboration between hospitals, clinics, pharmacies, and the Department of Health. But again, this coming week, what we're looking at is phase 1A. It will initially be the Pfizer vaccine, although the Moderna vaccine, which is also a messenger RNA vaccine, is scheduled to be delivered sometime before the end of the month. So you'll see Pfizer at first, then Moderna, and then we'll go through the different sequences of phase 1. So, I think this comes up. So vaccines are here. Does this mean the pandemic is over? And I think the important message is that getting back to normal, which is what everybody wants to do, healthcare providers, public health, and most notably people in the public, it's going to take all of our tools. So people should absolutely get vaccinated. But those 5 pillars that Dana and I have been talking about can't go away at this point. It really is going to take all of those interventions. One thing I'm very happy about is the vaccines clearly have bipartisan support. President Trump is referring to it as a medical miracle, pointing out that it has the potential to save millions of lives. Joe Biden COVID vaccines are a priority. So I think we're kind of all on the same page about how important the vaccines are in terms of getting us back to normal. We did talk about herd immunity. And if you remember, I talked about herd immunity without vaccination, which is not something that public health officials recommend. But herd immunity through vaccination is something that we very much are in favor of. However, herd immunity through vaccination clearly requires individuals in the community to get vaccinated. So educational efforts have already started on a national level, and I think they've started in our community and through the county Department of Health. So the CDC already has messaging out there, but the idea with these vaccines is you're going to protect yourself, but you're also going to protect your coworkers, your patients, and if you're a healthcare worker, your family and your community. So getting that message out there is going to be critical. So just to summarize, so there's been a dramatic increase in cases across St. Lawrence County. We're seeing a fairly clear pattern where the family gatherings that happened at Thanksgiving seem to be a primary source when we look at a lot of these connections. Testing in St. Lawrence County is accessible. The turnaround time is actually quite fast in general, and there's no cost to patients. Vaccines, which are coming out, are safe and effective. And as I said, the rollout has already started. However, vaccines just add to the toolkit, and it remains critical that people still use the 5 pillars of prevention. So that's my summary for tonight.
Mr. Forsythe.
Dr. Williams, thank you. Is it anticipated this is going to be an annual vaccine?
So right now, that's unclear. I think the hope is that it will not be a seasonal or annual vaccine like influenza is, but because so much is not clearly known about COVID, there's no certainty about that.
Okay. All right. Thank you.
Mr. Smithers.
Somebody that has had COVID, would you recommend they still be vaccinated even though they've had it already? What's the recommendation?
Excellent question. So the CDC is currently recommending that even for people who've previously had confirmed COVID, that as long as they've recovered, that they should still receive the vaccination. If they have an active case of COVID, it's recommended they hold off. But if they've had a previously documented infection, they should still get revaccinated. And that has to do with the idea that we don't know how long-lasting immunity is. And there's a concern that people could have regular COVID and then be vulnerable. So they should be vaccinated.
Mr. Haggard.
Mr. Fay.
Haggard in front of me.
Mrs. Haggard has a question.
Ms. Haggard.
I'm sorry.
Go ahead, Ms. Haggard.
Thank you, Mr. Chairman. Dr. Williams, I'm delighted to know that we don't really have a need to have like a mass testing event like Jefferson County. That's great. And I did notice that I think St. Lawrence Health System put out a press release explaining a lot about the different places that are available. And I think in talking to you, you mentioned something that I've had people ask me about, and that is, where do you go after 3 o'clock in the afternoon to get a test?
Sure. So, we've recognized that even though we were able to expand to weekend hours, the 3 o'clock cutoff, I think for some people is a challenge. So St. Lawrence Health System is actively looking to expand the hours during the weekdays. And there should be an announcement about that probably in the next several days.
Mr. Fay, go ahead.
Should we be doing more to promote to the public that vaccinations are awful important for us at the present time, either through press releases or basically even advertising if we have to, make sure that people are getting vaccinated?
Absolutely. So I think, messaging about the effectiveness and the safety of the vaccine is going to be critical in the weeks and months to come. So I think it should be an effort on the part of the Department of Health within the county. I think the state will have messaging. I think the CDC will have messaging, but absolutely, I think education and promotion of vaccination will be critical.
Thank you, Doctor.
You're welcome.
Go ahead, Tony Arquette, Legislator Arquette.
Thank you, Mr. Chairman. Dr. Williams, so it looks like the first wave of vaccinations will go to healthcare workers and the nursing homes. So if you're, say, somewhat of an elderly individual and you have some respiratory ailments, and you're anxious to get that vaccine, like many people are, what is your best advice at this point for that older individual to reach out to their primary physician to try to somewhat get in line?
Yeah, so I think certainly the Pfizer vaccine is different than many vaccines because it has this requirement for this very cold storage. So primary care providers are not necessarily going to have access to the Pfizer vaccine in the foreseeable future. But the county, the hospital, the pharmacies, I think are really going to coordinate the vaccination effort. And so if you look at phase 1C, that's sort of the greater population, people over the age of 65 with comorbid illnesses. I think you're going to see that pharmacies will be offering it, and the hospital likely to the general public, and the Department of Health will certainly play a role. One thing that I will do at these updates is make sure that people are informed about once vaccine is available for more broad distribution within the community. I'll make sure to tell people where that's going to be. And I think as we do, publicity and advertising, we'll include where people should be looking to get the vaccine.
Thank you very much.
You're welcome.
Go ahead, Mr. Burke.
Dr. Williams, I didn't see first responders specifically listed in any of those categories. Do you know, are they grouped in with the 1A or the 1B?
There's ongoing discussion, and that the phases that I put up there were the CDC phases. There's a slight variation in New York State. I think everyone recognizes that our first responders are in a tough spot when it comes to COVID, and we're all anxious to make sure that they get vaccinated as soon as possible. So they're high up in the list. We're trying to determine exactly where that is, but it's certainly 1A or 1B.
Thank you.
Mr. Akers.
Thank you. Dr. Williams, it looks like the fatality rate for the COVID is somewhere around 0.02. And we know that the flu, I don't know what the fatality rate is for someone with the flu. We do know that probably only 25 to 30% of the population gets a flu shot. So if we're going to be talking to the public about the need for vaccination on COVID, would the fatality rates be similar, or is the flu that much less than what we're finding with the COVID? That to encourage them both to get the flu shot and also vaccination for the COVID.
So, I mean, I think in an effort to get people vaccinated against COVID, I think the two things that some of the things I would emphasize are, you can look at the fatality rate, but I think looking at the people who have long-term complications from COVID can't be forgotten. People refer to the long hauler syndrome, and we're even seeing with college athletes evidence of myocarditis or inflammation of the heart after a very healthy young person gets COVID. So I think really emphasizing the fact that while the death rate is important and is real and is significant for COVID, it's not just the death rate, it's the risk of complications. When I talk to other healthcare providers who are very eager to get this vaccine, many of them are young, they're in their professional. They're mostly afraid of the complications of COVID. They're less afraid of dying from COVID. They're afraid of getting blood clots, having myocarditis, having a stroke. So I think emphasizing that it's not just death that we're preventing, it's long-term disability. And then I think the community responsibility aspect. I've always gotten thought as a medical professional, not because I think I'm going to die from influenza, but because I don't dare, want to expose my patients or my family to influenza. I have elderly parents, so it's kind of a personal and community responsibility factor as well. So those would be the points that I would emphasize.
Good. Thank you very much.
Welcome.
Any other questions of the doctor? No more further questions. Thank you very much, doctor.
You're welcome.
Thank you.
Okay, let's move on to resolutions. We have a resolution authorizing the chair to sign an intergovernmental personal act agreement with the Centers of Disease for Control and Prevention. Do we have a motion? Mr. Perkins makes the motion. Who seconds? I don't see the second. There, Mr. Smithers seconds. Okay, Ruth, I think, are you going to talk on this motion?
I am. Good evening, everyone. I'll be speaking to this resolution this evening. This is a relationship that we are fortunate, certainly in these times, but I think in general times with public health, have in place a relationship where the CDC continues some work with our public health director, Dr. McGuire, and they also provide 2% of her salary on an annual basis. So this has been in place since we hired Dana, and we look to continue that for 2021.
Any questions of Ruth? No questions of Ruth? Then all in favor?
Aye.
Opposed? Carried. Thank you, Ruth. We also have a resolution accepting additional stop DWI crackdown funds from the state of New York Governor's Traffic Safety Committee and modifying the 2021 budget for community services. Do we have a motion? Motion by Mr. Smithers, second by Mr. Perkins. Jay, would you like to address this resolution?
Yes, good evening. Thank you. So the Governor's Traffic Safety Committee originally awarded us $15,000 for the DWI Crackdown program, and they circled back around and awarded us an additional $2,000. So this is a request to modify the 2021 budget for the Community Services Stop DWI program.
Any questions, discussion? Being no questions, no discussion. All in favor?
Aye.
Opposed? Carried. We have a resolution. Oh, wait a minute. We've got a clinical update, I think, from you, Jay.
Yes.
Go ahead, Jay.
Yep. This is the community services update for November of this year. I mean, what I would say overall is that we continue to move the needle in a positive direction, albeit slowly. But I think it's important that we're not going backwards and we're not seeing less people and the production isn't decreasing. Again, for the month of November, the no-show rates dropped 2.5%. That may or may not continue, in moving forward. They do vary from month to month, but we had a pretty good month in November in terms of the no-show rates. The average counselor visits was up 5.49, up from 5.35 in October in previous months. Visits per 7 hours is up, 1/10 was 4.8 on average. It was 4.7 in October and 4.6 in September. In terms of the mental health visits per 7 hours, we're at 6.97. In October, we were at 6.7. September, we were 6.85. The weighted face-to-face for the chemical dependency department for program is 59.5. just a half of a point up from October. I will say we had the lowest person there with 40.3%. That person left about the third week of November. So there's always a loss in production when you're transferring the person's caseload to the other team members. In terms of face-to-face for the mental health, they're still, at the expectation or slightly above the expectation. They're at 75.9, whereas we have the expectation in terms of face-to-face billable hours, 72%. In terms of the prescribers, we're up slightly from last month, which was 10.4. We're currently on average 10.9. In terms of waiting lists, it says here that our mental health total on the wait list is 25. That has recently been bumped up to 35. And there was actually a total of 43. So we took 8 of those folks on the waiting list off, and we just gave them to a prescriber only because the counselor schedules have been full. So we do have an approved counselor position for the mental health clinic. So I've been kind of watching, the waiting list carefully and watching the numbers. Caseloads, run between 85 and a little over 100. So right now we potentially would have 43 that we could actually give to a new hire. But still, may not be enough to keep them busy, at least in the initial weeks or possibly months of their employment. So we're looking at that carefully. So in terms of individuals served, that went up again, went up from August to September. And percentages of all clinics, that's a point in time number. So when we run that, when we run those numbers again, sometimes they do go up as either we have collections and or things are posted at a later time than when we actually ran the report. So, those are, averages of our paid percentages, which is currently 84.37. Are there any questions?
Mr. Burke, go ahead.
Jay, thank you for the report. Just wondering what your assessment of the mental health is in the community. It's certainly been a challenging year for a number of people. Where are we in the delivery of services, and have you observed greater need? Would you mind giving us an update?
Well, I mean, I think things are definitely kind of ramping up when it comes to the mental health of our community. I think people are getting increasingly anxious about COVID as it continues to spread. I know, one of the problems that we have and always have is a workforce shortage. So I do know that, there are still wait lists with other clinics. Some of that is, because of, them having open positions. I know one of the wellness centers recently lost 2 counselors, so I'm sure that's impacting their wait list. So I think we brought in a number of different providers, for mental health services, but, I do believe that, the need still outweighs, the resources, certainly.
Thank you.
Any more questions for Jay? Yes, is it Larry? Do you have a question?
No, I don't have a question, Mr. Chairman.
Okay.
Thank you.
Okay. Okay, thank you very much, Jay.
Mr. Sheridan?
Yes,
I also have a discussion point, if I may.
okay, go ahead with that discussion point.
So I'm asking for consideration for rebranding or renaming our chemical dependency clinics. We've had a resolution prepared. There's been a lot going on, with, some of the grants and things that we've been involved with. But, I'm considering, putting a resolution through next month to rename St. Lawrence County Chemical Dependency Clinics to St. Lawrence County Addiction Services. When I came on board in New York State about 25 years ago, it was called Chemical Dependency Services. And don't quote me, but approximately maybe 10 years, 8 to 10 years ago, they changed it to substance use disorder treatment. And then more recently, within the last year and a half, 2 years, it's been renamed as Addiction Services. So we're actually about 2 generations behind, so to speak, in terms from what's currently being called Addiction Treatment Services. Oasis felt that it was less stigmatizing, to call it addiction services rather than either chemical dependency or substance use disorder. So we would like to move in that direction. In terms of, changing, our name, certainly, a lot of the paper products that we use, envelopes and, our cards and things, that we would just allow them to, decrease by attrition and replace them with the new name if it is approved. One of the areas that we would like to change, one of the reasons we'd like to change is we're going to be doing more advertising. We're going to do some bus wraps, and we would rather, have a more updated name to our services as we move forward with some of those endeavors.
Any comments on the suggestion from Jay to change the name? Okay, well, we're looking. Tony?
I was just simply going to say, it sounds like a very good idea to me. It's something that I believe will get the attention of folks in need, and it represents a change. So I think in this case, we're due for a change to improve on some of these numbers. So I applaud you, Jay, for this thought and idea.
Any other comments for Jay? Okay. Oh, looking forward to the resolution, Jay.
Okay, thank you very much.
Okay, thank you. Moving on to other resolutions. We have a resolution modifying the 2020 budget for social services. Do we have a motion? Mr. Dave Forsythe and Mr. Rick Perkins seconds. And Rita Kern, I think, seconds it too. All right. Cindy, are you available?
I am.
Okay.
Good evening.
Good evening.
So this resolution is to address our continued increased costs in our foster care adoption services and to address our additional HEAP expenditures. So first you're going to see that we actually, under increased appropriations, we have for personal computers, and it says related to COVID. So what happened there is back in the spring, we had ordered some computers due to the oncoming of COVID. And we have recently ordered more computers, non-COVID related, but out of our actual budget. They're already appropriated in our budget. So what we did is we had some funds there left over. So we're actually just moving it over just to make sure that we have the allotted amount of funds to pay for and cover the computers that we have coming in at this time. So that kind of was a little bit of confusion at first, but that was the reason for the way that was noted. So in addition, we have some additional HEAP expenditures that were a little bit unexpected. We had some paint, ceiling tiles, and some window coverings that were ordered. And so we just wanted to, we had a little bit of extra money, so that's where you're going to see the heat for the office supplies. And down under increased revenues, you're going to see for the same cost. So that was just a 100% coverage out of each. And then, of course, we're addressing the increased continued care of our foster homes. So we've had to move some money around down below under the decreased appropriations. You'll see where we have had, due to some of our unexpected decreased costs, we've been able to save some money there under a safety net that we have rolled over into our cost for foster care. And we've also had under our increased revenue where we've had some months where we've had some extra money come in after we reconcile some accounts. We've also been able to use those funds to move over into that account. So actually right now, even into year's end, we might have to move a couple things around, but we're actually doing very well.
Any questions for Cynthia? Ms. Terminelli?
Thank you, Mr. Chairman. And I'm not sure, Cindy, if this is a question more for you or for Ruth, but the computers with the $36,000, is that something that we can itemize under reimbursement through COVID?
So I had talked to Colin about this again today. So the thought was that we already had that money into our budget, and some of it we hadn't used, but we thought we still have some coded to that. So if we do end up getting funds back, then we can go back through and he can do the claiming at that time.
And Nicole, part of what I think we talked about this from a pre-committee standpoint as well. Certainly we want to see, based upon their budget, is their claim going into the budget year. So we'd like to claim against that. And then certainly we can look back and see any difference between the net the county spent and what they've claimed. We could put that against the FEMA funds that we're going to be seeking. So I think, yes, we'll seek every penny we can against these types of expenses. You bet.
Any other questions? No more discussion? Okay, all in favor?
Aye.
Opposed? Carried. Thank you, Cindy.
Thank you.
Next, we have a resolution modifying the 2021 budget for the Department of Highways for Depot Street Bridge over Deer River Bend, number 3220850. And I need a motion by Mr. Akers, seconded by Larry Denisha. And Don, would you like to discuss it? It looks like we're going to have an amendment on this resolution.
Yes, thank you. Good evening. And thank you for allowing me to bring forward a resolution dealing with the Depot Street Bridge and award. Yes, since this past week, the news from New York State is that they did find some funds available for the state aid. Initially, the contract came through from the state of New York with only federal funds in place. And this morning, I received a new contract with the updated Marchicelli, the state funds available. So yes, this resolution would need to be modified. And if I could, I'll go through the bottom portion where the accounts are, where the decreased unappropriated fund balance has 600,000. That should go to be changed to 150,000. Under the increased appropriated fund balance, that should go from 600,000 to 150,000. And under increased revenue, there should be an entirely new line added, HM 035915550 MA, and that's state aid, Marchicelli aid, and that line should be $450,000. Also up in the fourth whereas, that should be modified to state something to the effect that it's 80% of federal funds, 15% state funds, and 5% county.
Is that how you were going to make the amendment, Mr. Lightfoot?
Well, I was gonna go about it a little different way, but what the highway superintendent has made and amended with the dollar figures, perhaps I can put it in a little different words. With regard to the fourth whereas, on the second line starts with. Everything after with to 80% on the next line down, which would say 80% federal funds and 20% local match at this time, with the potential for a structure of. Those words would be deleted. In the next line down, after the wording and 5% local match, after that wording, pending state Marchicelli funding approval in the 2021 state budget would be struck. So I would make those amendments and the amendment as brought forward by the highway superintendent to this resolution and move for its adoption.
Okay, Mr. Forsythe seconds it. All in favor of the amendment?
Aye.
Aye.
Opposed? Anyone opposed to the amendment? Amendment's carried. Now for the original resolution. All in favor of the original resolution as amended?
Aye.
Any discussion? Go ahead, Mr. Arkwood.
I'd just like to be added as a co-sponsor to this resolution and the next
Okay.
one.
So noted. All in favor?
Aye.
Opposed? Carried.
Thank you.
Thank you, Don. Now, the next resolution is authorizing the chair to sign a contract with XXX for replacement of the Depot Street Bridge over Deer River, bin 3220850. We have Mr. Akers as the motion, Mr. Lightfoot seconds. Go ahead, Don.
Yes, this project, the low bidder, apparent low bidder was Friend Commercial Contracting, and in the amount of $2,797,686.
Okay. Any discussion? Mr. Forsythe.
Don, I don't remember ever hearing of this group. Are they new or where they at?
Actually, this company is out of Malone, and they did a very similar, actually the sister bridge to this in Russell on County Road 24 for us, nearly identical bridge a couple years ago, and we had statewide recognition for both the engineering and construction of that. So this contractor has done the County Road 24 and also the County Road 4 Eelware bridge as well. So, they've done two other projects for us, very good quality, with no issues.
Any further discussion or questions of Don? Dan Fay, Legislator Fay.
Could I ask how many people bid on this job?
There were three bidders.
Thank you.
Welcome.
Thank you, Mr. Fay. All in favor of the resolution?
Aye.
Anyone opposed? Carried.
Thank you.
Thank you, Don. Okay, next we're on to Vacancy Review Committee. Ruth, do you want to take over from here?
Be happy to. This evening's vacancy review summary is included in your packets. There are 7 departments. You will hear from 2 committees, the operations committee, and then 2 on finance. You'll see through the fact that you probably noticed community services doesn't actually have action for you. However, discussion took place at the meeting. So far, since my annual report to you, there have been 43 requests of positions. And this evening, we will get started with the sheriff.
Okay.
Good evening, Brooks.
Evening.
Go ahead.
So I've got 3 positions, one being a deputy sheriff position. This is last month I brought forward a change in my civil department where my civil officer was made into a deputy sheriff civil officer. So this vacancy for tonight is to backfill that deputy's position. So just to make it clear, there's no additional person being put on, just a backfill onto the road patrol. That'd be the first deputy position. The second and third are 2 CO positions at the jail, one through a termination, one through a resignation. To get to our mandated staffing level, New York State, we need to fill these 2 positions. And I'd like to fill them immediately because it saves on overtime because the low employee workforce creates overtime. So I'm looking to fill these 2 positions immediately.
Oh, I did. Yeah, okay. My apologies. Kelly just pointed out I was going off the summary instead of committee. I'm very sorry.
Well, that's okay.
You want to continue with Brooks or shall we revisit that under the other committee?
Yeah, I think if you don't mind, Larry, we'll continue with Brooke.
Yeah, that's fine. I thought I was the only one that was confused. I'm glad I'm
My
not.
apologies.
Dave was too.
I was too, but I didn't dare say because I'm the chairman. Okay, go ahead. That's okay.
Ruth, do you want me to go with the resolution or where are we at?
Just continue on. I think the group decided just finish up your other 2 in corrections. Then we'll go back to the agenda.
Yeah, I just stated those 2, so.
Yeah.
Okay. All right.
So then I think we're all set now for Brooks on the vacancies. We'll skip that part on operations. My apologies.
Okay. That's
We'll go
okay.
back to, let's get back over here now to social services.
Yes.
Cindy?
So tonight I have, well, there's basically 2 on the agenda, but the first one that I'll talk about is the employment and training counselor. And we have decided at this point to put that position on hold. That's actually a position that was half through unemployment and half through the WIOA program. So Ruth and I did meet with the staff and we want to do some additional looking into the position to see where it actually would benefit the community better or best. So we're going to put that one on hold for now. The second one that I have is a social welfare examiner. It's a permanent full-time position. This position was vacated December 12th, or yes, December 1st, 2020. It was vacated due to a resignation from a staff. The position just didn't work out for her. So this position is important because the examiner is responsible for interviewing clients applying for SNAP, determining eligibility, completing recertifications, and maintaining ongoing SNAP cases to ensure that the state mandated deadlines for processing applications are met. The average examiner is responsible for interviewing and determining eligibility for up to 30 applicants per month and up to 500 transactions monthly. And each position serves about 940 people. So we are requesting an immediate fill on this position.
Any questions? Cindy? I don't see any, Ruth.
Okay, the next one this evening is Office for the Aging. Andrea, good evening.
Good evening, everyone. The first one is a keyboard specialist that is open in our office due to a promotion. This is 100% funded through our New York Connects E&E funds. And it is currently, we have no keyboard specialists due to a medical leave and to the promotion. So we only have 2 within the department. And should I go on to the second one or wait for questions? Okay.
Any questions? No questions here on the floor. Nothing
Okay,
up on the panel. Go ahead.
Wonderful. The second one is an account clerk position. So this is the only account clerk that we have in our department. And this staff member left the department for a promotion in social services. And so we would be looking to fill this as soon as possible. This staff member works within our nutrition program, which, as everyone's aware, is one of our largest, most critical programs right now, performing all of the ordering and doing the billing and whatnot for that position. This is also in our 2020 budget. I'm sorry, I should actually note that we actually did an abolish and create because the county is relooking at our account clerk typist. So this was an account clerk typist. When you look at the job functions, the typist isn't really, all of our clerical staff are typists at this point. So we were able to lower the grade 1 step to a 16 from a 17. So that's why it says an abolish and create.
Okay, any questions? Thank you, Andrea.
Thank you.
That's all for this committee, Mr. Chairman.
Okay, we'll have your report at the next committee meeting, Larry.
Correct.
Committee reports. Mr. Akers, Board of Health, do you have anything?
Just the discussion has been primarily about COVID. I mentioned earlier about the cat problem in Waddington, and then there's a rat problem in another community. I suggested moving the cats to the rat problem, but we didn't take any action, so that's all I have.
Thank you, Mr. Akers. CDP Board of Directors, Mr. Lightfoot.
Thank you, Mr. Chairman. There was no meeting or is no meeting in December with the CDP Board of Directors. However, I can report to you that looking at the overall business that CDB attends to, they, even though they have been affected seriously by COVID, they have been able to keep their head above water, that they are continuing to provide in some areas appointment by, allowing folks in, much like the DMV by appointment. The Head Start program is down approximately 50% from last year. And obviously, according to the Felicia Dumas, she attributes that to the COVID, and people are reluctant to send their children into that setting. Even though it's been shown that children don't tend to get it. If they do, they get a mild case. They are not experiencing any revenue stream interruption from the state of New York. At least up to this date, they are getting the funds that they have applied for, and that they have not been docked any money or nothing has been withheld from that revenue stream. And they're looking forward to this coming to an end someday soon, so that they can carry on with their services at an increased level.
Thank you very much, Mr. Lightfoot. Community Services Board, Mr. Akers.
So Community Services Board, we had a discussion about the grant that Community Services applied for and received for a mobile unit for substance abuse out in the community. It's larger, it's a larger bus or van than what I thought it was initially, which we had looked at last summer when St. Joseph's had inquired about using SOAR money to actually provide that service. So it's a much larger unit, but the details are not there. And then we had basically reports from community services members as to the entities that they represented, what they were doing, and how they were performing during COVID. Thank you.
Thank you, Mr. Akers. Mr. Denisha, Office of Aging Advisory Board.
Thank you, Mr. Chairman. I don't have a meeting report because we have not had a meeting since the last time I reported. However, as Andrea mentioned, the increasing need, and you've heard me say this before, and you're going to hear me say it again. The need for volunteers for the Office for the Aging, especially for the home delivered meal program. There were a lot of folks that volunteered to help out of the gate when all this started. Well, now a lot of the folks that have been volunteering, that were volunteering, find themselves for one reason or another unable to do it. So the Office of the Aging is experiencing an incredible burden here. So I am encouraging once again for folks that have if you've got a couple hours a week, if you've got a couple hours a day, you got one day every other week. Please call Andrea Montgomery or Danielle Durant at 315-386-4730 and volunteer your services if you can at all. Thank you much.
So noted, Larry. Thank you. Youth Advisory Board, Ms. Terminelli.
Thank you, Mr. Chairman. And I'm wondering, Andrea's still on here about Office of the Aging. Could we get a press report put out about that? I know we may have probably done that in the past, and also some social media that we could share out there in hopes that that might get some volunteers headed your way.
Absolutely. We'll
Thank
take
you.
care of that. No problem.
Awesome. Okay, so our last meeting was December 3rd, and just to touch on some of the highlights, we've seen some of the work from that meeting. As you know, the RDP allocations came in. We were able to sign for that money to be received, and then of course to approve the programs that the money was granted to in our last board meeting. We are doing right now currently some youth bureau activities, some virtual trainings and webinars that are coming up. We have a January vision boards with Ellen Hurlbut from St. Lawrence Health Initiative, and that will be on Thursday, January 7th at 7 p.m. via Zoom. And information can be found on the Youth Bureau Facebook page. And then in February, date to be determined, they're hoping to do a virtual workshop with Healthy Valentines hosted by Caitlin Potter from SNAP and the Cornell Cooperative Extension. We're also currently hosting a membership drive for both our youth board committee members, but also our youth committee, which is the teens from the county. So if you know of anybody that's interested in joining either of those committees, we would love some bio forms and applications to come through, and we welcome people to attend the meetings just to get a feel for what they're like, if anybody is interested. So you could contact myself or Alexa Backus for information about that. Let's see. Our next youth committee meeting is this Wednesday at 4 o'clock. An update on the mask design contest. The masks were distributed. So thank you to many of the legislators and to Ruth and to Alexa for getting those out across the county. They surely were appreciated, and many of you probably saw the photos and the press releases on that. So very, very thankful for that work. And another thank you to Logan Lejean from Colton Pierpont for a beautiful design. And then we wrapped up our North Country Art Teachers Association fundraiser with some other products with the top 3 mask designs. So hopefully at the next meeting, I'll be able to bring to you an amount that of the proceeds that are being donated to the North Country Art Teachers Association from that. And lastly, we are currently hosting a holiday card drive. We're looking for cards, letters, notes, pictures from the youth across the county. This is a partnership between the Youth Bureau and Andrea and her office with the Office of the Aging, so that the baskets that get distributed to our clients over the holiday season can be accompanied by a nice little note, paying the kindness forward with some notes and cards and letters from the youth in our community. So we are accepting those until the 18th, and they can be sent right to Alexa's office. And that's all I have.
Thank you, Nicole.
Mr. Chairman?
Wait, Nicole, we have a question from Mr. Forsyth.
Nicole, what age group, what are you looking for?
For the participation for the youth committee, is that what you're asking?
Yeah.
So right now, our members are all teens. They're probably the most likely to be more active in it. We do host virtual meetings right now, but really, I think any age, as long as they're, high school, probably 8th through 12th grade would be appropriate for that. And committed, the kiddos to be involved and come up with ideas. This mask design is just an example of something that came from them, as well as some of these virtual courses that we'll be hosting. So it's pretty exciting.
Okay, thank you.
Yeah, you bet.
Mr. Chair?
Yes.
If I could just update on Nicole's holiday card drive as of noon today. There are, with a goal of 700, there are 1,164 cards received. So they've exceeded their goal by 66%. So keep the cards coming. The schools have really taken this up and sent in by the classroom dozens and dozens of cards. So it's really been a wonderful gesture. And we have until Friday, so keep them coming.
And thank you for that update. So that's great news, because anything over our goal, we were hoping to distribute out to the nursing homes for the folks there as well. So it's just some holiday cheer.
That's right.
Thank you very much, Nicole, for the report. Any old or new business to come before the board? Services Committee? None, being no old or new business. We probably have a need to go into executive session, but do you want to do that during operations, Ruth?
Please.
Okay. So if there's no more further business to come before the Services Committee, I move we're adjourned. New record? Speed-wise or forgetting names that I know wise or what?
An hour and 4 minutes. I think paper has like 12 minutes.
Name a country. These are getting tough. Name a country that starts with M. Country that starts with M. Come on, think. Go east or west. Moldova. Moldova, okay. Moldova. Final one. Name an animal that starts with E. How much you make it for?
for the approval of the minutes from November 9th. Moved by Mr. Sheridan, second by Mr. Perkins. Any discussion? All in favor?
Aye.
Ayes? Carried. First up, we got from Planning, Jason, authorizing the chair to sign a contract with New York State Department of Transportation for the purchase of buses and modifying the 2021 budget for the planning office. Do I have a motion by Mr. Lightfoot, second by Mr. Perkins? Jason?
Thank you. Good
You're
evening, all.
welcome.
This is pretty straightforward. The county wrote a grant back in 2018, funds through the Modernization and Enhancement Program, or MEP program. The county was successful in securing that grant for $1.5 million. And we intend to purchase 10 28-passenger buses with those funds. There's no local match required. And we're looking for authorization from the chair to sign the contract.
Are there any questions for Jason? Seeing no questions, all in favor?
Aye.
Anyone opposed? Carried. Second up is lead grant update. Discussion. Go ahead, Jason.
Great, thank you. So since we last met back at operations in November, just give you some new numbers since then. We have seen 3 more lead inspection risk assessments complete. So the lead inspection risk assessment, or LIRA, is the final step before a bid can be sent out for a project. So again, we're making progress. It's slow progress, but there is progress there. We also have 2 more homes that have had preliminary assessments done, and we'll move to that next step, that LIRA step, hopefully moving forward in the next little while for that. We're also looking to bundle some of the lead work with another grant that we have open right now, a direct home ownership assistance grant, or DHAP grant. That, as you may remember, that's the program that allows for funding, mortgage buy-down assistance funding for first-time home buyers. What we see as sort of a win-win is that if we can use the DHAP monies to purchase the homes, often there is repair work that is done. Some of that repair work includes lead abatement. So if we can shift that lead abatement expense over to our lead grant, it will allow for additional funds to be used in the DHAP grant, and also will help with our production in the lead grant. Where it gets complicated, I guess, is that there are certain requirements that have to be met. There needs to be qualifying age children in the home, the DHAP purchased home. But we're hopeful that we can make this work, and that will help us up the numbers a bit with the lead grant. From the I guess the advertising side, and public health is really taking a primary role here. Despite all their incredible work with the pandemic, they also are able to continue with some of the advertising work for the lead grant. And they also have sent out 109 notices about the program to those who have been tested for lead. So that's, again, we'll continue to keep the ball rolling on the program and get more interest. With regard to that, we also intend to do some bus wraps. I know Jay had mentioned bus wraps earlier. We look to reprogram the bus wraps that had the census advertisements on them. That, of course, is past due now. So we're looking at taking the vinyl off those buses, the census vinyl off the buses, and putting lead promotion vinyl on those buses. And that should happen in the next week or two for the 3 buses and 1 van. And that's all I have right now. Happy to answer any questions.
Anyone have any questions for Jason? I've got 2 quick ones, if that's all right. Do you know what you've expended so far? What the expenditures are today?
Yes, about we just put in a request for another $25,000. So I think we have expended about 180,000 out of the $1 million.
Okay, and do you have a breakdown between advertisement and actual repairs?
I can get that for you. I don't have it right off the top of my head.
Okay, I was just curious. Okay, thank you. I'd appreciate it. Any other questions for Jason? All right, thank you, Jason.
You're welcome. Thank you.
Next up, Matt Denner. And we have a resolution authorizing the chair to sign a maintenance contract with Business Electronics for voice recorders located at the backup 911 PSAP in Messina. Do I have a motion for Mr. Perkins, second by Legislator Smithers and Mr. Denisha? Go ahead, Matt.
Good evening, everybody. Last month I was here for the maintenance for our PSAP in Canton. This is same thing. It's for the maintenance of our recorder located in Messina.
Any questions for Mr. Denner? No further discussion. All in favor?
Aye.
Anyone opposed? Motion carried. Now we have a discussion on the tower update. Matt?
All right, as you all well aware that we're in the progress of putting 3 new towers up, Hammond, Waddington, and Governor. I'm happy to report that they're almost all complete. Governor is complete. We had 3 antennas put on that tower Wednesday. Now we're looking to get the new repeater and duplexer programmed and get that put in service to get that one going. Hammond and Waddington have small punch lists. Contractor is working on them this week. We're hoping to have all that wrapped up and everything completed by the end of the week. We are doing a little bit of work out front in Canton. We had a few lines that were giving us some problems. We're getting some static. Come to find out, a couple of lines had some issues, some water in them on some couplings. So we're changing out some of the lines from the top going down and some of the mess on the bottom, and that'll be all hopefully cleaned up by the end of the week. As soon as we get that all done, then we'll be moving back from Messina back to Canton.
Any questions for Matt on the towers? Mr. Denisha?
Thank you, Mr. Chairman. It's actually not on the towers, but Matt, could you give us just a 1,000-foot view of the what we talked about today regarding backup plans for the 911 center in the event that we have some a large number of folks out?
One thing that we've had to come up with this whole pandemic that's going on is if it would whip through my department, how would we handle that? With some suggestions from staff, we reached out to some individuals that were retired. They would be willing to come back in an emergency situation. Also, we looked into neighboring counties. If need be, if we could borrow some manpower from them to come down and give us a hand, which they agreed. In return, we agreed to be able to help them just as well as they agreed to help us in case that ever happens. So let's hope that it never comes to that. But I think we're doing pretty good. Everybody's doing their assessments really well. Social distancing is happening. As many of you are aware, we had a little incident at the end of last week, which I think could have been a lot worse, but because the way staff has been handling and doing things, I think it turned out the best that we could ask for.
You all set, Larry?
Thank you.
Mr. Arquette?
Matt, are you in the North Pole right now?
I am at Santa's workshop. I can't go home. I mean, there's always something to do, Tony.
All right. Thank you.
Any other questions for Matt? Thank you, Matt.
Thanks, guys.
Next up is the sheriff. We have a resolution adoption of an implementation plan for executive order number 203 of Governor Andrew Cuomo, New York State Police Reform Reinvention Collaborative. Moved by Mr. Lightfoot, second by Mr. Smithers and Mr. Perkins. Sheriff?
Sorry, Tony, I'm not an elf here, so I'm just alone. So this resolution is, as I brought forward, starting July 13th, the executive order from the governor is a 4-step plan, as I've explained. This resolution would be a part of step 4 in its passage, and then the chief executive officer, Mr. Lightfoot, will forward it to the state. So this resolution needs to be completed for step 4. Just a note that we will have a hearing next Monday, December 21st, for public comment before this resolution.
Okay, are there any questions for the sheriff? No further discussion. Anyone? All in favor?
Aye.
Anyone opposed? Motion's carried. County clerk. We have a resolution modifying the 2020 budget for the office of the county clerk for overtime costs for the Department of Motor Vehicles. Move for its adoption. Moved by Mr. Perkins, second by Mr. Smithers. Sandy, are you there?
I am.
There you are.
Can you hear me?
Welcome. Yeah, I can.
Okay. So I'm gonna need to, we originally had $2,500 in contingency. And, I did that. I'm going to need an extra 30. We've been taking some work from downstate. They put out a request to all the county clerks asking for extra help. We just finished about 400 extra transactions, and I've told them I can do another 400 to 500.
Good, good. Any questions for the county clerk? Mr. Akers?
Cindy, is the drive-through open yet?
It is not.
So is there anything that can be done that we can help you, or are you reaching out to anyone to get that?
Meeting, oh, I'm sorry. I will be meeting with Mark Walzik's office tomorrow to have that discussion.
It seems pretty ridiculous that that's not open and every other drive-through, whether it's McDonald's or Dunkin' Donuts or Taco Bell or whatever, is open.
Yeah, I think it's a lot safer too. I'd rather have my staff working through the drive-through than in person.
Right. Okay, thank you, Sandy.
Any other questions? Ms. Haggard?
Thank you, Mr. Chairman. Hi, Ms. Santamore, sorry. This doing stuff for downstate is a big moneymaker for our county. Is that not correct?
Correct.
Great. Can you give us an estimate of how much it provides, or is it?
It depends on what they send us. The last batch of 400 that we got, we figured in overtime and all that. At the end of it, it came out to about an extra $2,000, but still it's not bad after overtime expenses and everything to still be able to net that.
Thank you.
You're welcome.
Ms. Curran?
If they won't let us open the drive-through to interact with people that drive up, maybe we could use that space dedicated to do transactions like the mail-in transactions or the transactions that the people put in the little box.
That is what we did.
Oh, I figured you were already on that. Okay, thank you.
You're welcome.
Any other questions? All in favor of the resolution?
Aye.
Anyone opposed? Carried. Next up is Human Services. Johnny, the resolution's authorizing the chair to sign a contract with trusted employees for background screening. And we have a motion by Mr. Perkins, seconded by Mr. Smithers. Johnny?
Hi there.
How you doing?
So I am, in April of this year, we started background checks on all new hires per civil service regulations to verify experience and education, as well as other statuses. And at that time, we got quotes from 3 different vendors. The purchasing department reviewed these lists for compliance with the procurement policies, and we went with the lowest bidder. I would like to renew the contract with them for 2021 and up to 3 years thereafter.
Are there any questions? All in favor?
Aye.
Anyone opposed? Carried. Next one is health insurance related to COVID discussion. Go ahead.
Is that me?
Yep, that's you.
Okay. Okay. So I believe earlier today, Ruth did send out or put out on the Google Drive the COVID related reports that we have from our healthcare administrators. And so I'm going to just go over that. This information is through November 30th of this year. So we currently cover approximately 2,525 lives in our healthcare plan. And this includes retirees. Through November 30th, we have covered 721 tests for 447 unique members. The average total cost per test visit is $343.60. The total cost per visit includes the plan cost, the member's cost, and the cost of coordinating benefits. It is my understanding that the plan costs include costs for all services and treatments associated with the visit. So if they go there and there's complications or anything like that, they're included in that. The location where individuals are getting the test is also having an impact on the cost. So example, there are 29 members tested in the ER, and those made up approximately 30% of the total cost to date. Of the 447 unique members tested, there were 14 with a confirmed diagnosis. And of these 14 members, they had 34 claims, which may or may not be associated with a COVID test. So the way they're doing these reports, they're limited at this time on how they're being able to pull the information out. So at this point, I've asked for a report on the actual average cost of the test alone, without all of the treatment and everything else, the entire visit with that. But I'm wondering if there's any other information you would like me to request or clarifications that I can get for you. So if you have a chance to look at those reports and you have, clarifications you want further, or you want some more information, then you could email me or you could ask me now or whatever.
Are there any questions?
Dave?
Are there any questions? Mr. Burke?
The ER visits are costly to our employees as well. Their copay, is that correct, Johnny?
Yes. Well, if they're admitted, it doesn't cost. The cost is covered for the employee. But if they're not admitted and it's not emergent, then it's $100. If it is emergent, it's $50.
Mm-hmm. So the people going to the ER, not that we're in the position to judge the need for that, but it would certainly be my belief that that they were sufficiently concerned to need some medical assessment.
If I could, Chairman Forsyth?
Mrs. Haggard? I heard someone saying.
Ruth.
Oh, excuse me, Ruth, I couldn't see your hand. Did you raise your hand?
No, I asked.
Go ahead, Ruth.
One of the things I think when it comes to emergency room visits that's interesting in the documentation is there were 29 members who visited the ER and another 20 that went to urgent care. And certainly we know that urgent care is a diversion from the emergency room, but in the North Country, it's not always available. But in that comparison, you can see the data that would suggest, 9 fewer members, but an extraordinarily reduced cost. And we're looking at the ER care at about 73,000 of that 247 we talked about. So those numbers, I think, demonstrate certainly an expensive area, but there often isn't an alternative to that.
Yeah, and I think it goes back to Mrs. Haggart's original point of getting service after 3 o'clock. A lot of people may get it on a Friday night late or a Saturday morning, and it's probably a limited audience at the time, I would think. But Ms. Haggart, you had a question also.
Did I butt in on Mr. Burke?
I think John was done. Were you done, John? Or?
No, I'm done. I'm done.
Okay, thank you.
Mrs. Dorothy, the people that are going to the ER, it wouldn't necessarily be for a COVID test, but don't you have to have a COVID test when you go to the ER, even if you've broken your foot?
So they do, right, so what's associated with wherever they go, so they would have this COVID test. That's why they're being pulled into this report in the first place. And then the claim might not necessarily be related to COVID either, from what I understand.
Thank you.
But they're tested, yeah.
Okay.
Any other questions?
Yes.
Oh, Kevin, go ahead.
So, Ruth, this is a question for you. Will these costs be reimbursable from either the federal or state government?
I haven't seen that health plan costs are included in that, but I can take a look for that, Kevin.
So has any directive been issued for any county employees to actually use the Reonix test? Has that directive been issued from this point on?
It has not.
And do you think it would be worthwhile for us to do so?
I think we could have a conversation with the hospital systems. I think that it would be a challenge depending on the way that covered lives in our plan come into the system, whether it's through a doctor's appointment, through an ER visit, through urgent care, for them to be involved in the decision-making relative to how the test occurs. But I'm certainly happy to have that conversation and see what room there might be for that type of setup and bring that back to you.
Well, I think it would be instrumental to know what the actual cost, because you have many combined costs in these numbers.
You do.
So I guess what I would like to, and I think Johnny alluded to it, was finding out the actually true cost of the COVID test, that part of whatever it's the ER visit or whatever.
Yes.
Certainly at the last meeting, I was concerned. I think the number that you had given us was 649 tests. Now it's 721. And I think that we had done the math, and it was $382 per COVID test. So obviously, there's other factors in there. It'd be nice to know what the actual COVID test costs.
Certainly. And the figures I provided last meeting were from up to October 31st. So you also have another month's worth of data included with these reports.
Any other question? Oh, John, go ahead.
I wasn't sure whether Kevin was saying that maybe we should try to steer people to the cheaper test sites where the quick tests are, or if that, and I may not have understood correctly, Kevin, but I guess when it comes to healthcare, it's something that we need to be very careful of. It's a personal decision, and I wouldn't be in favor of trying to steer our employees in any particular direction. They need to make that decision themselves.
Kevin, follow up.
So my original questioning of the cost was because it was a possibility that the county system may be getting gouged or charged exorbitantly. So now that we know that there are other figures, other factors that were involved in the $343 per test, certainly any county employees that have maybe in an environment where there was somebody that has been exposed to COVID or either has COVID, but they have no symptoms, rather than have them go to the emergency room, I think it would be prudent for us to encourage them to utilize the rapid testing, where we had just spent $100,000 in the contribution towards public health, and that would lower the cost for the county. Certainly if they have symptoms, John, I would not want them to be going to that rapid testing site. I would rather have them see either the urgent care, their doctor, or in the worst case scenario, certainly the emergency room. But certainly, in a situation where there's a family member or maybe a neighbor or whatever, or somebody in your work environment whose relatives had the COVID and you want it to be assured, I think the rapid test would be prudent, in that we'd get a result back quicker also. So that would mitigate any spread, and also lower the cost to the county with the cost of this service.
Rita, did you have a question? You have a hand up or no? I'm sorry. Yep, go ahead.
That's okay. Dr. Williams was going to put out some guidance on and I thought it was going to kind of go as a press release to when would be a good place, a good time to go to what place for a test. Like if you're short of breath, if you're having an acute emergency, the emergency room obviously is the place to go. If you have some symptoms, but you don't have short of breath, shortness of breath, you could probably call your doctor. You could probably, seek one of the open testing sites, a call ahead to let them know that you have symptoms so that they can keep you away from other patients. But I was kind of hoping I think he did put that out someplace. But the problem with the emergency rooms is even though you would think not really anybody would be there right now, they're still overwhelmed because they have some nurses that are missing because they've been exposed or are sick. And they still have a lot of patients that are having other problems in the community. So they're still kind of overwhelmed this time of year. So I'm hoping that, is Dr. Williams, are you still on, Dr. Williams? He may be gone. I'll check with him later, but I was pretty sure he was going to put out some guidance. But I think that they told us before that the tests themselves are around $150 a piece, no matter where you have them. That testing cost may have come down some as they get more tests available, but that's all.
Ms. Taggart.
I think the worst case scenario is discouraging people, regardless of where they choose to go, and having them come to work sick. I think that's like really causing a lot of problems, and not just our county employees so much as people who won't get paid unless they come to work. It's so sad. But at the same time, if we start limiting where they can go or what we prefer, I'd hate to see that create a problem in our departments where people were like, well, I couldn't get tested because I couldn't go to such and such a place. It'd be a real shame if they came to work sick. And people are doing that because for whatever reason.
Well, go ahead, Tony.
Yeah, I think that all of the last 4 or 5 speakers, I think that the answer there to all of their concerns is continued education, continued information, and it's ongoing and it's a moving target. But I think if we continue to, through press releases, through announcements through the public health department, continue to inform folks that, these are the proper channels to take, like the question I posed earlier with an 80-year-old individual. That was a question that got posed to me this morning, and it's a very bright individual that just didn't, he says, as the vaccines are coming in, how do I get in line for that? And so again, I think that most of the concerns that were just shared, can be overcome through further education. Not that it's easy, but again, I think that's where we need to head. Thank you.
And I think, go ahead, Kevin.
Well, again, I'm just speaking about county employees. County employees do have benefits. They can take sick time, that if they're not feeling well, certainly we don't want them to come in if they're not feeling well. The beauty of the rapid test, this is one reason why I support it, is the 24-hour results. Yeah. I mean, if I suspected that I was around a COVID individual or even had a slight sniffle or even some indication at all that I had exposed myself, I would want the 24-hour test. So maybe our county employees are not cognizant of the fact from this point on, they should be, that these 2 testing sites for the rapid tests are available. And we should encourage them to use that for the rapid result.
Yeah, and following up on Dr. Williams earlier, I think availability of machines, there's a lot more machines around now. I think they said St. Lawrence Health Systems has 6. So I think that'll help drastically. So, and there may be more in the works. So I think it'll all help. I guess we'll move on to vacancy review. We've done the sheriff. So Dale.
Yep, Dale's here.
Governmental services. Yes, we did, Ruth. Governmental services with Dale, I guess. How you doing?
Dale, I think you're still muted.
You're muted, Dale.
Is that better?
Much.
That's much better.
Sorry about that. Okay. This position is for a building electrical maintenance worker. The gentleman that we're replacing is retiring on January 29th. He's been out since last February on sick leave, and just no way he can come back to work. So he is taking medical retirement. And the need for this position right now it's really great. We've got the Nyserda lighting grant that we are in the middle of. We've got to have 50% of this done by the end of June. And with just Sean, the only electrician, and all the work he has to do, it's just, we don't have time to actually do what we need to do to get this completed. And we do seem to have a lot of electrical work and data work that we are doing over the last few months. I don't know why, but we seem to have a little uptick in that type of work. So we are asking to fill this immediately. And got any questions around this?
Any questions? Larry?
Yeah, Dale,
Go ahead, Larry.
Dale, I do have a question. Is this electrician or is it an apprentice?
This is electrician, but not a journeyman level electrician. Okay.
Well, that's clear.
We are looking for somebody that does have some experience. I would like to see somebody possibly with a 2-year degree at a Canton College. But as far as journeyman, somebody that's gone through, a 4-year apprenticeship, at this point, I don't think we need that level. It would be nice if once we hired somebody, if they'd be willing to go through that. Mm-hmm. It would just improve things a lot. But right now, I need somebody with electrical background that can do a lot of the, mid-level electrical work, I guess I would say.
So it could be somebody with a background, say a 1-year certificate course in construction electrician from SUNY Canton.
Yes, or a 2-year at BOCES, the electrical trade at BOCES even, yes. Like some kind of education, some kind of experience, but not, Sean is a journeyman electrician. But at this point, I don't think we need that level.
Okay, very good. Thank you.
You're welcome.
Any other questions for Dale? All right, thank you, Dale.
Thank you.
We'll move on to the county administrator's report, Mrs. Doyle.
Yes. As far as COVID-19 is concerned, I think you heard Dr. Williams mention the 5 pillars yet again. This week, we're going to be stressing the 4th pillar of staying local. Shopping, traveling is very important during these uncertain times. So you'll see some media, some press communications coming from the county, emphasizing the importance of staying local while our numbers continue to rise. I'll be sending another mass mailing out to both Amish communities, both in the Oswegatchie area as well as the Brazier area, to share more information with them and try to keep them informed as best we can. Reopening Task Force will convene tomorrow at 3, and they have been instrumental in facilitating the communication with our businesses. And I think it's a fine time to do that when we're talking about things like returning to work or having to take time away because of waiting test results and or being in quarantine. The vaccine committee is going to be meeting weekly on Tuesdays. And I think one of the things we talked about in the work group this morning was about facilitating that education component of the vaccine. So while we expect that limited doses will be arriving soon, I think there will be some time to educate the public and also answer questions and alleviate concerns as best we can. We did have an additional staff member diagnosed with COVID-19. They had not been in the office, so I believe that's the 3rd scenario where we have been fortunate that while they had symptoms, they did stay home. They did not come into the office, and therefore exposure was extremely limited, as you heard from Mr. Denner. That brings our total on staff to 7 to date. The call center, I just want to mention for a moment, we do have the call center open at Public Health. We are staffing that with county employees. As you know, we're continuing with our 50% in-office staffing. And so if there are areas where folks don't particularly have a full plate when they're not in the office, we're asking that they sign up and spend either a morning or an afternoon answering phones for public health in the call center, and or that they get trained on contact tracing. So I do have to commend county staff, retirees, and all of those folks who are willing to help. It's just been extraordinary to see everyone participate in the volume and try to help out where they can. I wanted to mention to you, you'll remember at our board meeting, our interim historian, Nancy LaFavre, was with us, and we talked briefly about honoring Doug White, who will turn 100 years old on December 22nd. So my hope is that we can bring a certificate to the special board meeting and commend Mr. White. I don't believe that he'll be able to join us, but we would be able then to add that to the accolades that will be presented to him on his birthday the following day. Just a quick update for you on the county website. As you'll recall, we launched the new county website this summer. On the public side, we've had an increase of visitors that's pretty remarkable. For the 3 months, September, October, November of 2019, we had 19,700 visitors. The same period for 2020, we had 51,600 visitors to our website. So same period, November of 19 to November of 20. 21,000 to 59,000. So we certainly are seeing, and it couldn't have been a better time to update our website, to get information out to the public. Certainly Monday through Friday, you see those maps updated, and they've really become a resource for folks getting accurate information about COVID-19, but also being able to navigate more easily through the website to find services if they are in need. We met today. Just about the website also, we're hoping to launch, and we're working on the intranet, which will be an employee-facing side of our website that will provide a more open line of communication between departments so that one another knows what departments are providing, the services that may be in need, and certainly get information out as it becomes available. Today we met to finalize the fleet vehicle order for 2021. For the order between 2020 and 21, we'll be saving just under $10,000. We'll be making 10 leased vehicle replacements. So that means 10 vehicles that are currently leased will be turned in, and we'll lease 10 new vehicles. We also then will be, I believe, at the final few vehicles left that the county owns. Now this doesn't necessarily get into the larger equipment that we're talking about in highway for next year, but we'll be purging the fleet of 3 non-leased vehicles and purchasing or leasing 3 new ones. And that's an overall cost you'll see in your budgets. The fleet line is in the treasurer's office. We purge out the vehicles that are attributed to community services and social services and public health where we can get reimbursement. But annually, that's about a $200,000 cost to the county. Some years ago, when the fleet started, I believe it was around 2008, the county was spending at that time approximately $775,000 to $800,000 reimbursing mileage. And this venture, while the transition's taken a little longer than the 5 years that we planned, I think there's been good judgment used, and we've replaced these vehicles and brought, I believe, also an evolution. If you recall, we were purchasing Ford Focus. Now we're looking more at the sedan type vehicles. So folks are safer out on the roads when we send them. We, this last year, purchased a couple of, or at least a couple of all-wheel drive vehicles as well, to make sure when folks have to travel through the Adirondacks in the winter, that we're putting them out there in safe vehicles. Next Monday will be the last meeting of the year, and it certainly is going to be a full one. We will have a public hearing for planning at 5 o'clock. At 5:10, we'll have a public hearing, as you heard the sheriff this evening, on police reform. And we'll schedule the special board meeting for 5:25. We will also then have the finance committee immediately following that special board meeting. And our thoughts were, since there may be folks who'd like to participate in the public hearing for this meeting, that we would include, which is a little bit different than normal, a community participation in case the time that comes to begin the special board meeting doesn't provide an opportunity for all folks to speak. So we'll add that to the agenda. We'll set up Mr. Lightfoot as we have in the past with names that he can call in from the lobby, and we'll make sure that it's COVID safe if folks want to attend. And lastly, I just wanted to remind you, that the board adopted the 2020 legislative agenda in February. And this year, I think we did a little bit of foreshadowing, asking the state for timely reimbursement. We're gathering information now from departments. You've heard through the budget process, and you've heard since that time about reductions in places like highway and community services and potentially social services programs. Currently, they're being called withhold. However, the withhold continues. And so we'd like to put some numbers to that and provide them to you so that you understand where reimbursement either for services that have been performed and or aid that normally would arrive, so that you have a handle on the outstanding state aid toward the end of the year. And that's all that I have.
Any questions for Ms. Doyle? Mr. Reagan?
Ruth, do we have any idea whether or not any of the vaccine has arrived in St. Lawrence County yet?
I believe that it is expected by the end of the week.
By the end of the week? And do we expect it to go directly to the nursing homes?
I can find that out in our vaccine meeting tomorrow and share that out with the board.
Thank you.
You bet.
Do we have any influence over ensuring that it goes to the nursing homes, since we're having a problem in some of our nursing homes?
I'm certain Dr. Williams will make that known, but I'll make sure.
Thank you.
Any other questions? Ms. Taggart?
Mrs. Doyle, who was responsible for the changes to the website? Did we hire that out, or was that an in-house thing?
It was a combination. So we had a committee in-house. We conducted an RFP process, and we used a company called Discover eGov. And they have worked with us to roll out that new website, and they're continuing to work on the intranet with us as well.
I just want to say that I really didn't have a lot of experience with the previous one, but this one is great. The difference is amazing, maybe because I knew better what I was looking for, but it's really, really nice. I appreciate their work.
And that process has been steered internally by Dylan Soper and Mike Cunningham. So certainly proud of their work on this.
Any other questions? We'll move on to committee reports. First up, Ag and Farmland Protection Board, Mr. Denisha.
Thank you, Mr. Chairman. We had our last meeting on Thursday, December 3rd. It was via Zoom. And we discussed a number of things. I think one of the most important things we discussed was the comments to draft regulations for New York State Renewable Energy Growth and Community Benefit Act. There were some comments that the planning department made. We reviewed them, and I guess most notably, my estimation, there were talked about site restoration, specifically decommissioning for solar sites or wind. In New York State Uniform Fire Prevention and Building Code, to make sure that there was emergency coordination with local first responders. And the other thing that was key, I think, in regards to ag resources, one of the lines in the act, they referred to an active or a time limit on active farmland. And I can't remember exactly what the time limit was, but we felt that there should be no time limit, because farmland is farmland, whether it's active farmland or if it's inactive. Once it's taken off, once it's taken out of production and turned over into a solar site, a wind site, whatever, it's out of forever. So. That's one thing we proposed was no time limit. And our next meeting is February 4th, 2021.
Okay, thank you, Larry.
Thank you.
Alternatives to Incarceration Board, Mr. Burke.
Apologize. There have been no meetings of the board in the past quarter, so there's nothing to report.
Okay. Thank you, John.
You're welcome.
Board of Trustees for Supreme Court Library. Not even sure who that is. Oh, Ms. Haggard.
No, it's nobody. And I was
Oh.
gonna volunteer. I don't know if.
You want to be on it?
Yes, I'll do that. Seriously.
No, did you have a question? I'm sorry.
No, that's why I raised my hand, because we haven't had anybody, and I didn't know whether our chairman was waiting for another attorney to come along. But that belonged to the previous District 10 legislator, and I'd be happy to do it if that's okay with the chairperson.
I believe we'll pass that along to the chair and let him address that. Thank you. Good suggestion. Emergency Medical Service Advisory Board, Mrs. Kern. Ms. Kern.
Dog had a stop that. I'm trying to talk. So we had a meeting and they were discussing, hey, stop it. I don't know, she was bothered for some reason. So we had a meeting and I didn't get to go, but I got the minutes. And so basically they had a long discussion about COVID-19, obviously how it's affecting the number of people who are willing to be volunteers and go out to certain calls. As you know, the addresses of people who are COVID positive on quarantine or isolation are in the system with a special code. So when you're getting calls to go to some of these addresses, you're having problems getting volunteers to go there. They're afraid of catching it or whatever. Also, the cost of PPE, which has risen. They said, for instance, it used to be about 85 cents for a mask. Now sometimes they're paying up to $5 a mask to get N95 masks, and there's problems getting them. But that was the bulk of the discussion and some basic organizational kind of stuff about who's going to be at what meeting. And then our next meeting is January 26, 2021.
Okay, thank you, Rita. Environmental Management Council, Ms. Terminelli, who I can't see.
Way for a meeting.
What's that? I'm sorry.
Ms. Terminelli stepped away for a meeting. She had to attend. She'll
Okay.
return as soon as she can.
So we'll move on to the next one. Fire Advisory Board, Mr. Denisha.
Fire Advisory Board, Mr. Chairman, we met on October 15th via Zoom and discussed the number of calls that had come into the dispatch center and talked about the new towers, communication towers, just some general stuff. And our next meeting is actually this coming Thursday via Zoom.
Okay, thank you, Larry.
Mm-hmm.
Inter-County Legislative Committee, Ms. Kern, who stepped up. You back?
I was trying to quiet those guys down before I had to talk again.
There you
So
go.
we have not had another meeting. We had the last meeting in October, and November and December, there's not going to be a meeting, and they'll resume in January by Zoom.
Okay, thank you, Rita. Jury Board, Mr. Sheridan.
Yes, Mr. Chairman. I did meet with the jury board, chairperson being Honorable Mary Farley, and the commissioner of jurors, Melissa Sweet, and we met on the 23rd of November. And we were presented by the commissioner, the board of members, with copies of the 2020 calendar year statistics. And they're quite involved. I won't go through all of the statistics with you, but I'll touch on to some of them. A discussion of the criminal, civil, grand jury, and town court statistics contained in the report was also had. Ms. Sweet informed the board members that it was critical for her to keep track of jury pool as we're running out of jurors in St. Lawrence County. A discussion about the decrease in the number of jury trials this year due to the COVID-19 pandemic. and the positive effect it had on the jury pool. Jurors were only summoned 15 times this year. And Ms. Sweet continues the best practice is staying in close contact with the judges' chambers to avoid unnecessarily summoning jurors in an effort to preserve the county's limited jury pool. The commissioner and the trial judges worked very hard to achieve juror comfort and satisfaction. And the commissioner plans to have another meeting prior to the beginning of the year with Judge-elect Story in regards to jurors, juror trials, grand jury. The discussion was also had about the COVID-19 pandemic and how it's affected scheduling jury trials, and that we only have one courtroom that can accommodate a jury trial. Criminal jury trials are to be scheduled on the odd number court terms, and civil jury trials are to be scheduled on even number court terms pursuant to the directive set forth in the 4th Judicial District. Commissioner Sweet advised that the grand jury is running smoothly. District Attorney Gary Pasqua has advised the Commissioner that he may have to increase grand jury to 2 days a week in 2021 versus the 1 day a week in 2020. Grand jury is meeting in this board room here as the conference room, which is room 226, is not large enough to socially distance the grand jurors. And jury selection and impeachment is also taking place here in this boardroom. Personnel-wise, Ms. Sweet advised us that the grade 12 position has been filled in her office and will be shared with the Franklin County Commissioner of Jurors Office. Ms. Lindsay Cota started in February 2020. Some of the statistics I'll just touch on is the qualification questionnaires, just to give you an idea. The questionnaires that were sent out as of November this year were like 7,299. The pool to send questionnaires to consisted of 5,736. The jurors available to summons was 1,830. The qualification rate was only 34 to 40%. The total jury per diem cost for 2020 was $37,000. For the trial and civil jury statistics, there were like 3,095 jurors summoned for the year, and $17,920 was the per diem cost for the year. The trial jurors summoned 15 times. Trial jurors appeared 8 times. Trials that ended with a jury verdict 4. 5 civil trials versus 12 criminal trials. There's 505 jurors appeared. 1,096 jurors received good service out of a jury pool for 6 years. What happens when you get the good service? You don't have to report again for 6 years, which gives us the issue in terms of why the jury pool is running in the trouble. On the grand jury statistics, the total per diem cost was $19,080. Total days appeared 39. Number of grand jurors summoned 490. Normally, St. Lawrence County has 6 grand jury terms a year. Terms are 8 weeks long, except for the last one. That term is 12 weeks. Grand jury usually meets every Thursday. For the towns and the village courts, no jurors were requested by any town or village this year. And that's it.
Thank you very much. Any questions for Bill on that? All right, moving on to planning. You're going to tell us there's a Bass Pro Shop coming or something. Please, Dan. Cabela, something.
I'm not going to relate to that. I think our planning department director, Jason, did a good job talking about a number items that we discussed at the meeting earlier tonight. I would just like to point out that maybe some of you people don't know, as a planning board member, you have to have 4 hours of training every year. And the department this month put on a land use training program on Zoom for an hour. So it was an excellent one. The state also puts on some programs for training that that we can all take, and basically the planning department lets us know when they're taking place. I listened to a Zoom one on basically subdivisions. I've been involved in subdivisions throughout my career, and I thought it was an excellent presentation. And I believe that these are taped. If anybody has interest in some areas of planning, they should check with the planning department to see if there is something that you can listen to. This one on subdivisions for 2 hours. If you know anybody that's working on a subdivision, I thought it was an excellent presentation. And I guess that's all I'll report right now. Thank you.
Thank you very much, Dan. Okay, move on to old and new business. Anyone have any old business? Anyone have any new business? That was easy. And I guess we move into executive session, Ms. Doyle, for
negotiations,
excuse-
litigation. Oh,
was that you had old and new business, Rita, or you're on mute?
I was all ready to second the move into executive.
Oh, okay. Go ahead, Ruth. I'm sorry.
that's okay. Negotiations, litigation, personnel for a unique circumstance with a non-union employee, and appointments.
Okay, do I have a motion to go into executive? Mr. Smithers, seconded by Mr. Perkins. And Mrs. Kern, or Ms. Kern. We're going into executive session.
Chair.
Is there any further business? If not, we're adjourned.